Good afternoon, everyone, and thank you for joining us in this Webicon brought to you by Cardinal Santos Medical Center. I am Eddie, your moderator for today's session. When you find out that you have cancer, you may feel a range of strong emotions: disbelief, fear, and sadness, anxiety, and even anger. Such feelings are understandable given the series of losses that you may experience. It can be a loss of doing normal activities, financial struggles, changes in relationships, or worse, even losing one's sense of self. It usually takes time to adjust to these changes. Things have been even more difficult with the onslaught of the pandemic. So with the increased vulnerability of cancer patients who depend on life-saving treatments in hospitals. So in an effort to raise awareness about the Big C, along with cancer care, Cardinal Santos Medical Center is holding a Webicon entitled One Big Fight, a Webicon on ways to prevent, detect, and treat cancer. Part of our advocacy at Cardinal Santos is to make quality and innovative healthcare accessible to everyone through education. As October is Breast Cancer Awareness Month, we want to do our share in shining the light on relevant issues and information on cancer prevention and management. So what's in store for us today? For today's session, we will hear from the three of our experts on cancer care from Cardinal Santos Medical Center. We will also hear about the story of one of our patients who has experienced firsthand the services and procedures that we will be discussing today. So hopefully, from her perspective, we can all learn about what truly matters when it comes to caring for one's health and well-being. And after that, we will open the floor for questions. We would like to ask everyone to please stay on after our open forum for our group photo ops. So before we begin, just a few reminders for all of us. First, may I remind all panelists to mute their microphones during the session to avoid distracting our speakers. For the open forum, please type your questions using the Q&A function of the Zoom. And finally, after the session, please take time to give your feedback about this Webicon by logging on to www.menti.com using the code 77151011, or you may also access the evaluation form, which will be sent to you after the session. So to officially start this session, allow me to introduce to you our first speaker. Our first speaker is an active consultant at Cardinal Santos Medical Center, along with other hospitals in the metro. Her passion and dedication for training and research is evident as she teaches. She is an assistant professor for young doctors who want to pursue their career in healing those who are in need. She also serves as a member of committees for training and research in top hospitals in the country. She spearheaded various research to further understand the intricacies of different types of cancer. So to further understand cancer, what is it, what it is, who is at risk, how to prevent it, ladies and gentlemen, may I call on Dr. Kitchie Antipuesto.
Hi, Ma'am Eddie. Thank you very much for that wonderful introduction. I would like to share my slides. Okay. Good afternoon to everyone, and I'm going to switch to our Filipino language since this is a Webicon, this is a lay forum. Magandang hapon po sa inyong lahat. Ako po si Dr. Kitchie Antipuesto, isang medical oncologist ng Cardinal Santos Medical Center. At ang tatalakayin ko po ngayon ay tungkol sa cancer, mga sanhi nito at mga paraan paano ito maiwasan. So ano nga ba ang cancer? Ang cancer ay isang kondisyon kung saan nagkakaroon ng abnormal na pagdami ng mga cells. Ito ay nagsisimula kapag ang mga cell ay nagkakaroon ng abnormality or mga mutation at mga abnormal na cells na to ay dumadami at nagbubuo ng isang bukol o tumor. Ang mga abnormal na cells na to ay pwede din pumunta or mag-spread sa iba't ibang parte ng katawan. Ang cancer ay sanhi ng DNA mutation or gene mutation. Ang bawat cell sa ating katawan ay mayroong DNA at ang isang buong DNA ay binubuo ng isang gene. Ang DNA ay siyang nagsasabi ng instructions sa cell kung ito ay lalaki o titigil sa paglaki. Pero pag ang DNA or gene ay may mutation or may abnormality, pwede itong bumuo ng isang bukol o tumor. So ano nga ba ang mga sanhi ng gene mutation or DNA mutation? Ito ay pwede magsimula mula kapanganakan, pero ito lamang ay 3 to 10% ng bahagi ng sanhi ng cancer. So ang mas malaking bahagi ng sanhi ng cancer ay mga non-hereditary tulad ng smoking, obesity, lack of exercise, and unhealthy diet. So ito ang mga sanhi ng cancer at makikita nyo dito na mas madami ang mga preventable causes o mga sanhi na pwedeng maiwasan. More than 55% actually ang preventable causes ng cancer. At makikita nyo dito na 33% ay dahil sa tobacco use or smoking, 20% ay dahil sa obesity or overweight, 16% ay dahil sa pathogens, viruses, or infection. 5% ay dahil sa insufficient physical activity or lack of exercise. 5% ay dahil sa poor dietary habits. At 2% ay dahil sa exposure to UV light. Lahat ng mga ito ay pwedeng maging sanhi ng genetic mutation or DNA mutation na pwedeng magdulot ng cancer. So madaming mga haka-haka tungkol sa cancer at pati mga sanhi nito. So sasagutin ko ang mga ilang myths and misconceptions tungkol sa cancer. Ang una ay, ang cancer daw ba ay isang death sentence? Ang sagot dito ay hindi. Umuunti pa nga ho ang namamatay sa cancer dahil may improvement ang cancer treatment and cancer prevention. Pangalawa, ang pagkain daw ng sugar o mga matatamis na pagkain ay nagpapalala pa ng cancer. Sagot dito ay hindi, wala pong ebidensya, wala pong clinical research na pwede magpatunay nito. Pero pag nasobrahan po ng pagkain ng matatamis, pwede itong magdulot ng obesity na isang sanhi ng cancer at iba't iba pang mga sakit. Ang payo namin palagi sa mga pasyente namin ay kumain in moderation. Ang pangatlo, pwede daw lumala or kumalat pa ang mga cancer cells pag binayopsi ang bukol. Hindi po ito totoo. Kailangan po natin i-biopsy ang bukol para malaman ang tamang diagnosis. Ang pang-apat ay ang paggamit daw ng cellphones ay pwedeng magdulot ng cancer. Hindi rin to totoo. Ang cellphones ay naglalabas lamang ng low frequency energy na hindi nakaka-damage ng genes or DNA. At ang panghuli, madaming mga pasyente ay nagtatanong dito kung maaari silang uminom or mag-take ng herbal products dahil lunas daw ito ng cancer. Hindi po ito totoo. Wala pong clinical research or ebidensya para magpatunay dito dahil ang herbal products kung ititake pa or iinumin pa kasabay ng chemotherapy or cancer treatment, pwede pang lumala ang cancer. Let us always remember that the early detection of cancer can save lives. At isa sa mga paraan para maiwasan ang cancer ay sa pamamagitan ng cancer screening. Ang cancer screening ay isang proseso na makakatuklas ng cancer kaagad bago man ito magkaroon ng sintomas. So, umpisahan natin sa breast cancer screening. Sa mga kababaihan na age 25 to 40 years old, pwedeng gawin ang clinical breast exam at ang unang hakbang para sa clinical breast exam ay inspection. Tingnan maigi ang left and right breast, pati na ang kilikili. Tingnan kung may skin abnormality, skin discoloration, nipple retraction, or nipple discharge. Pagkatapos nito, sa Latin, ang breast, ang left and right breast, kung may makakapang bukol, kung may natuklasan kayong bukol or any abnormality, kailangan magpakonsulta sa doktor. Sa mga kababaihan na more than 40 years old, pwedeng gawin ang clinical breast exam plus an annual screening mammogram. At sa mga pasyenteng may increased risk for breast cancer, pwedeng gawin ang breast MRI plus mammogram. Ang mga pasyente na nasa grupong ito ay mga pasyenteng may BRCA gene mutation, kagaya ni Angelina Jolie, or yung mga may first degree relative na may BRCA gene mutation, or mga may previous history ng radiation therapy sa dibdib. So ano nga ba ang mga benepisyo ng breast cancer screening test? Ang clinical breast exam ay nakakatuklas ng 40% ng breast mass or breast cancer. Samantalang ang mammogram naman nakakatuklas ng 77 to 95% ng breast mass or breast cancer. At ang MRI naman ay nakakatuklas ng 75 to 100% ng breast mass or breast cancer. In addition, nakakabawas ng 41% to 62% ang dami ng namamatay dahil sa breast cancer sa pamamagitan lamang ng mga screening test na to. So dumako naman tayo sa colorectal cancer screening. Nag-uumpisa ang colorectal cancer screening sa age 50 years old. Pwede natin gawin ang fecal occult blood test or FOBT once a year. Ito ay eksaminasyon kung saan sinusuri ang dugo sa sample ng dumi ng pasyente. Pwede din gawin ang flexible sigmoidoscopy every 5 years with FOBT every 3 years. or ang colonoscopy every 10 years. Ang dalawang procedures na to ay isang procedure na gumagamit ng scope or tubo na mayroong maliit na camera sa dulo para makita ang kabuuan ng rectum at ang colon. Ang pinagkaiba lang nila is yung sigmoidoscopy, nakikita yung dulo ng colon, samantalang ang colonoscopy buong colon ang makikita. Sa dalawang procedures na to, makatuklas ng polyp o maliliit na bukol na pwedeng maging cancer. So mga pasyenteng may inflammatory bowel disease or may mga lahi ng colorectal cancer or polyps or may mga genetic syndrome, maaari kayo magpakonsulta sa doktor or sa oncologist dahil pwedeng gawin ang colorectal cancer screening even before the age 50 years old. So ano naman ang mga benepisyo ng colorectal cancer screening? Ang FOBT ay nakakatuklas ng 50% ng colorectal cancer mass or polyp. Ang flexible sigmoidoscopy naman ay 65% na nakatuklas ng colorectal polyps or cancer at ang colonoscopy ay 75% to 95% ng colorectal cancer ang matutuklasan. Nakakabawas ng 18% to 68% ng dami ng namamatay ng colorectal cancer sa pamamagitan lamang ng mga screening test na to. So, pumunta naman tayo sa cervical cancer screening. Ito ay nagsisimula sa age 21 years old to 65 years old. At ang test para sa cervical cancer screening ay ang pap smear. Ang pap smear ay isang eksaminasyon kung saan kumukuha ng sample sa cervix para masuri or makita kung may mga abnormal or cancer cells. At the age of 31 to 64 years old, pwede itong sabayan with the HPV test. Ang HPV naman ay isang klase ng virus na pwede magdulot ng cervical cancer. Ang pap smear ay nakakatuklas ng 50% of cervical precancer at ito ay nagdudulot ng 70% ng pagbawas ng dami ng namamatay dahil sa cervical cancer. So punta naman tayo sa prostate cancer screening. Nagsisimula ang prostate cancer screening at the age of 50 years old. At pero mga pasyenteng African Americans or may mga lahi or may first degree relative na may prostate cancer, maaari itong simulan at the age 40 or 45 years old. Ang test para sa prostate cancer screening ay PSA or ang prostate specific antigen blood test. At ang frequency or dalas ng pag-ulit ng test na to ay depende sa resulta. At ang PSA ay nakakatuklas ng 67 to 80% ng prostate cancer at ito ay nakabawas ng 25 to 31% ng dami ng namamatay dahil sa prostate cancer. Ito naman yung panghuli nating cancer screening, ang lung cancer screening. So, kung ang pasyente ay between 55 to 80 years old at naninigarilyo or tumigil ng manigarilyo at may 30-pack year of smoking history, pwede magsailalim ng lung cancer screening test. Paano ba i-calculate ang pack years or ang smoking history? Tandaan lamang ho, ang number of packs of cigarettes smoked per day, i-multiply ito sa number of years you smoke, and if the result is at least 30 pack years and you are between 55 to 80 years old, pwede kayo magsagawa ng low-dose chest CT scan. Ang low-dose chest CT scan ay mayroong less 90% ionizing radiation kumpara doon sa regular na CT scan. At pag ginawa nyo ito, nagbabawas ng 20% ng dami ng namamatay dahil sa lung cancer. So ano naman ang mga preventive measures ng cancer? Siyempre, dapat we have to quit smoking at panatilihan smoke-free ang tahanan. We have to eat healthy diet, prutas, gulay, or mga pagkain na rich in vitamins, minerals, and antioxidants. Mga kababaihan na may newborn babies, ang breastfeeding po ay pwedeng mag-reduce ng breast cancer risk. Iwasan ang pagbibilad sa araw, iwasan din ang air pollution, be physically active or exercise, and limit alcohol intake. At syempre, kailangan nating tandaan ang mga cancer screening programs na pinag-usapan natin kanina. At ang huli ay vaccinate. May dalawang vaccines para labanan natin ng cancer. Isa dito ang hepatitis B vaccine. Pwede itong ibigay sa mga infants up to age 18 years old or sa mga taong at risk for hepatitis B infection. Ang bakunang ito ay nagbibigay ng 98 to 100 protection laban sa hepatitis B infection. At ang hepatitis B infection ay ang most common na sanhi or cause ng liver cancer. So kung ito ay may iwasan din ang liver cancer. Ang pangalan naman ay ang HPV vaccine. Ito ay pwedeng ibigay at age 9 to 26 years old. Pwede din ito ibigay sa mga adults age 27 to 45 years old, considered by the OB-GYN. And there are madaming mga HPV vaccines, pero ang pinakamaganda ay ang monovalent vaccine or the Gardasil 9 na nagbibigay ng 90% cervical cancer protection. Ito na ang panghuli kong slide na pag-usapan natin na ang cancer ay isang kondisyon na nagkakaroon ng abnormal na pagdami ng cells at ito ay sanhi ng genetic or DNA mutation. More than 50% ng sanhi ng cancer ay preventable, and prevention is very essential in cancer treatment. Also, early detection through cancer screening can save life. And napag-usapan po natin yung iba't ibang cancer screening tests ng breast cancer, colorectal cancer, cervical, prostate, and lung cancer. At ang mga layunin nito ay for early detection and of course to reduce mortality rate. At ang panghuli, syempre kailangan natin bisitahin at magpakonsulta sa mga oncologists para makalikom ng tamang impormasyon tungkol sa cancer. And I think that is my last slide. Thank you very much. I'll stop my slides.
Wow, thank you very much, Dr. Kitchie, for that very comprehensive and very clear lecture on the prevention of cancer. I'm very much amazed how you did it in Tagalog. So we will be hearing from you soon during the open forum at the latter part of today's session. So to move on to our next speaker is an active consultant at Cardinal Santos Medical Center and also in various hospitals in Metro Manila. To further make an impact in the lives of our most vulnerable, she champions as one of our partner doctors with Cancer Care Registry Philippines, or the CARE Philippines, to maintain a hospital-based cancer registry system, which helps the Department of Health to prioritize activities and programs based on the needs of our patients. Her passion and dedication did not go unnoticed, as she has received the following awards: the European Society of Medical Oncology Research Fellowship in Palliative Care, and the American Society of Clinical Oncology International Development and Education Award in Palliative Care. So with her commitment to educate the public regarding cancer, she also serves as lecturer in various organizations and institutions. So friends, I am honored to present to you Dr. Pauline Cauton to talk about the topic, Living with Cancer, Accurate Diagnosis and Effective Management of Cancer.
Hello, good afternoon everyone. Kung kayo po ay nabilib kay Dr. Kitchie sa kanyang Filipino, ako po ay kinabahan kasi akong susunod sa kanya. Okay, hold on. Let me just prepare my presentation. My slides are good. Okay, so after you discover or find out that you have the dreaded big C or cancer, no? Usually ang susunod ay kayo ay magugulantang, no? What now? Paano na? Ano nang gagawin ko? Ano nang susunod? So it's just this big question mark that is looming over our heads. Okay, so what I want to try to show you this afternoon are usually the things that your doctor will want to figure out with you, no? Para hindi po siya listahan lang ng mga kailangang ipagawang workup, no? There's really a rationale behind everything that we will need, no? All the information we need to treat you, to help you out, okay? So I sort of summarized them into 3 questions. So unang-una, the thing that we need to get to the bottom of is what kind, right? So si Dr. Kitchie po was able to show us what cancer is at the heart of it, no? Which is uncontrolled cellular growth and division. So the thing is, hindi po lahat ng cancer pare-pareho, no? There are different kinds of cancers and different kinds of treating them, no? So one important thing to find out first is anong klaseng cancer po ba ito? Next is where else? No? So I think what we also know is that cancer can travel and go to other parts of the body. So it's very important for us to find out, has it affected the nearby organs, or has it affected even distant organs, no? Some distant part of the body. No? So we need to find that out. And then lastly, are we ready for treatment? So we want to know if yung body po natin, actually we always hear that question, di ba? Kakayanin ko po ba, Doc, ang gamutan ng cancer, no? And we also want to find that out for ourselves. So there might be some tests that we ask for to make the body ready, or to really determine if treatment is feasible. Okay, so firstly, what kind? So there might be exceptions, but for most cancers, this would entail a biopsy. No? So ano po ba ang biopsy? Biopsy is basically getting a sample of the tumor, and then ito po ay inaaral under the microscope and adding special stains, special tests to really tell our pathologists, no, yung mga nasa lab, kung anong klaseng cancer po ito, kung saan po ba siya nanggaling, no? Which will, of course, will inform us how to treat it. Sometimes we request for tumor markers, which are typically blood tests. They are not really used to diagnose, no? Hindi po pag may nakita tayong tumor marker, ganitong klaseng cancer to, etc. But these will help, especially in cases na medyo difficult yung nakita sa biopsy. It helps support what kind of cancer it is, the kind of cancer diagnosis it is. And there might be other tests that are geared towards this question. But suffice it to say, it's very important for us to try to find out what cancer this is. No? Kasi hindi po siya isang gamot lang para sa lahat ng uri ng cancer. Okay? Next, for the question, where else? No? So usually we use some sort of imaging, no? Or a way to see what's going on inside our body. Right? So this can be anything from an ultrasound, yung tinatawag po na CT scan or MRI, so, or PET scan. So what test is requested depends also on the cancer. So there are some sites or some locations ng cancer na ang ideal po ay CT scan. May mga iba ang ideal naman is MRI. May mga iba kitang-kita, no, na kung PET scan po ang gawin. No? So it's important for us to try to see this usually in the very beginning. Kung ano yung mga apektado, tapos yun po ay i-monitor din. Sometimes we subject some lesions also for biopsy. No? Ibig sabihin, kunwari, for example, you have a tumor in the breast, and then meron pong nakitang kulani, no, sa may armpit area, no, sa may kilikili. No, so it would matter in the management often. Natin if kasama po ba yun sa ating mga kailangang i-gamot, right? Or sa pag-stage na tinatawag. And then the last question is, are we ready for treatment? So usually we will check your body and all your functions. So we will check your CBC, which is a blood test, yung ibang tests sa blood chemistry, which will really assess also your liver function, your kidney function, how well you can take the treatment that you might be subjected to. We will probably check your heart as well. No, this can be with an ECG or a 2D echo. We might even ask our cardiologist friends to assess you and to maybe give us a clearance also if you're okay to proceed with treatment. There are some treatments that need the lungs to be assessed, no? So with a pulmonary function test, minsan po nagte-test din kami to check if you have certain infections, no? Not only for the cancers that are linked with these infections, but sometimes also we want to make sure that you don't have a latent, ibig sabihin yung hindi pa nagpaparamdam na infection, which might flare up or get worse when we start treatment, no? So what we do is we want to know para we can start the treatment for these infections as well. So this is for hepatitis, HIV, etc. There are some cases where we might need to check your thyroid function as well. And yun nga po, yung tulad na nabanggit ko, your doctor might decide na kailangan natin ng ibang service, no? Whether cardiologist, pulmonologist, nephrologist, no? Para sigurado po tayong everything is okay before we proceed with treatment. Okay? So now that we know what kind of cancer we have, how extensive, no? Whether it's just in one area or in more than one area, and we know the status of our body, no? So what now? What kind of treatment is waiting for me? So that's the next big question. Okay? So very generally, no? These are the three main types of treatment that would be the options. And again, different kinds of cancers, different kinds of treatment. And even within the same kind of cancer, depende po sa sitwasyon, no? There are certain specifics like particulars about its location, how extensive it is, no? So basically the information that we found out from the earlier part of the workup, right? It can influence, no? Nag-iiba po kung ano ang best mode of treatment. Okay, so very briefly, let me describe what these modes of treatment entail. So firstly, surgery, alam niyo naman po, ang surgery is basically removing something, no? When we're talking about cancer. Okay, so basically, if we can remove it for some cancers, okay, so it's not the main treatment for all types there, but for a lot of types, surgery is the definitive treatment. Ibig sabihin, kung kayang tanggalin, gusto nating tanggalin. No? Nilista ko po dito, curative or definitive surgery. Ibig sabihin, yun yung main goal nyo, no? Na you want to remove all the cancer cells that you can see, no? At least with the naked eye. There are some other situations where we would employ surgery. Yung tinatawag po na debulking, ibig sabihin binabawasan lang. Ibig sabihin we can't remove all of the cancer's cells in the body, but we try to remove by surgery all that we can. And then another scenario po that we would try to employ surgery would be a palliative intent. Ibig sabihin if there is something that is causing the patient pain or affecting some function, you know, whether pag-ihi or pagdumi or paghinga, no? There are certain surgical procedures we can do to alleviate or to palliate those symptoms. Okay, so that is going under the knife, no? So basically that's what surgery is. Okay, so I use the word chemotherapy, but what I really mean po is systemic therapy, meaning therapy that goes through the whole body, right? So basically, it's not just the traditional chemotherapy. So it can be the actual medicine, no? O yung gamot po na nakikita nating binibigay sa aming cancer center sa Cardinal, no? Na dinadaan sa IV, no? That really attacks the cancer cells, right? Other forms of systemic therapy, basically medicine that goes through the whole body. You have your hormonal therapy, which can either be an injectable or can be oral form as well. Meron din pong tinatawag na targeted therapy, which can be in IV form, yung monoclonal antibodies, or meron po yung mga small molecules na tinatawag na oral, no, na TKI. So still, even if iniinom lang po siya, it still goes through, its effect goes through the whole body, as opposed to surgery that is just one area. And then the last kind that I listed here is immunotherapy, which is a rather newer mode of treatment, but again, it goes through the whole body. Okay. And then last mode that we can use to treat cancer is also radiotherapy. So like surgery, it is a localized kind of therapy. Ibig sabihin, if I were to explain to you how radiotherapy works, it's concentrated rays of high energy. So kung isipin niyo po yung mga energy from an X-ray, right? It's highly concentrated, but only very precisely targeted in a small area. So that's why the side effects, if you might be apprehensive na, di ba masama po ang high dose na radiation? Yes, it is, but that's why they target it very precisely just on the tumor. So if you think about it, it's toxic. High radiation is toxic. That's why they're only delivering it to be toxic to the cancer cells or to the tumor itself, right? So you can see here, there's mapping that's happening so that it can be very precise and very bullseye only, to the tumor itself. Okay. So it can be definitive, na pwedeng yun po it'll take care of the whole problem of the cancer. It can be adjunct, meaning it's in combination with some other mode of therapy, whether a systemic type of therapy or surgery. And it can also be palliative. It can help in cases where meron pong masakit caused by the tumor or maybe sites of bleeding, etc. Okay. So with these three, one question would be, which comes first? Do I need all? And which one will come first? And again, it's always different, for each kind of cancer and for each kind of situation, really. Right? So this could be one example, one scenario, na surgery came first, and then depending on the final, pag sinabi pong final histopath, so kung ano po yung tinanggal sa inyo, yun po ang susuriin, and then they will assess if they were able to get all of the cancer, kung yung mga margins po, where they cut it, kung walang present na cancer cells doon, ibig sabihin nakuha nila ng buong-buo, right? So depending on the final results or output of the histopathology from surgery, you might be recommended to undergo chemotherapy or radiotherapy or both. Pwedeng sequentially, meaning one after the other, right? Or there might be certain situations where inuuna po yung chemotherapy or radiotherapy in that matter. So pag ganun po, ang tinatawag sa naunang chemotherapy ay neoadjuvant. Ibig sabihin, before the definitive treatment. So for cancers na ang definitive treatment po ay surgery, maybe you might be recommended to undergo chemotherapy first. Why? Maybe to shrink the tumor so that the surgery will have a better outcome. To ensure na mas madadalian at mas maganda ang makukuha nilang margins from your surgery. They will do chemotherapy first, surgery, and then maybe either more chemotherapy after, depende sa kaso, or even radiotherapy afterwards. So these are just examples, samples. There are actually situations as well na pwedeng magkasabay po. So merong tinatawag na chemoradiotherapy, concurrent chemoradiotherapy. Ibig sabihin, it's radiotherapy primarily na may sinasabay pong chemotherapy, and basically it's a lower dose chemotherapy, and what it tries to do is to make the radiotherapy more effective, right? So giving those together, pwedeng definitive na yon, na just the chemoradiotherapy, or that can even be neoadjuvant as well, or adjuvant, meaning after surgery, or after some other different modality. So it might seem complicated, right? Parang who decides which comes first? who decides which modalities we should use for my specific case. And I think I want to stress here also, again, as I mentioned, iba-iba ang tipo ng cancer, kaya mahirap pong mag-compare with the kapitbahay or the pinsan na, bakit yung sa ganito yung ginawa? Bakit yung dun sa kakilala ko, maski na parehong breast po kayo, no? Parehong breast cancer, hindi po lahat ng approach pare-pareho. No? There's always a different approach for each kind of scenario, right? So it's very hard to compare. But again, the next question is, who will decide which comes first and which should be employed? And the important thing here is that the best way to approach cancer or to treat cancer is with a multidisciplinary team. Ibig sabihin, hindi lang iisang doktor, no? Pero lahat po ng espesyalista na nag-aral about the different modes of treatment of cancer, na they all come together at nag-uusap at sila po ay nagdi-discuss ano po ba ang best approach for this particular patient, right? So that's the kind of care also that we wish to give our patients here at Cardinal. Multidisciplinary cancer care, you know, where there is the radiologist who will help us interpret the imaging to see kalat ba to ng cancer o hindi, mukhang galing ba to dito o hindi, involved ba tong area na to, yung oncologist, yung medical oncologist, as well as your radiation oncologist. So there is a different kind of oncologist that gives the radiation and gives the chemotherapy or systemic therapy. Your primary physician, who first saw you and recommended the tests or the screening tests, your surgeon, your pathologist who looks at your biopsy and whatever was taken out of your surgery, and kung sino-sino pa pong nagsusupport, including your palliative physician, who will take care of all the other things that need to be addressed during and even after treatment. So I end you with this, na it really takes a village, not just to raise children, but also to take care of our cancer patients. Thank you very much.
So thank you very much, Dr. Pauline. I know very well you have explained the technical terms, all like tumor markers, the radiation therapy. You have explained the cancer care management. You make it simple, brief, and clear. So thank you very much again. Moving on, it is an honor to introduce one of our prominent oncologists in Cardinal Santos Medical Center, whose leadership and passion for oncology is an inspiration for doctors and patients alike. Currently, she serves as the director of the Cancer Institute of the hospital. She is also the president of the Philippine Alliance for Brain and Spine Tumors, meant to alleviate the struggles of the indigent community who are struggling with tumors. In her quest to further understand breast and lung cancer, she is currently involved in a number of phase 3 clinical trials in the country. She has published and presented several scientific papers in medical oncology. So please welcome Dr. Maria Luisa Abesamis-Tiambeng.
Hi, good afternoon. Thank you, Eddie, for the very kind introduction. Magandang hapon po, ladies and gentlemen. I would like to thank you all for joining this Webicon. I hope you have learned the most important points about cancer diagnosis, prevention, and treatment from my colleagues, Dr. Kitchie and Dr. Pauline Cauton. I am very proud of them. No? Ang gagaling nila. The management of cancer has certainly evolved over the past decade. Today, we no longer treat cancer as a deadly disease, but rather as a chronic illness that we can manage with medication and other forms of treatment. This positive development has been made possible by landmark discoveries in cancer management, such as more advanced surgical and radiation therapy techniques and novel smart drugs that target the cancer but not the normal cells, improve the immune system's response to cancer, and enhance cancer cell killing at the genetic level. I am both a personal witness to and an active participant in this battle against cancer. I was only a third-year medical student when my father was diagnosed with stage 4 nasopharyngeal cancer 28 years ago, which inspired me to pursue medical oncology as a career. Like all doctors, I rose from the ranks and became a medical resident of this institution, a clinical fellow in UPPGH and the National Cancer Center Singapore, a junior consultant, senior consultant, before I became director of the Cancer Institute. As mentioned by Eddie, I have been principal investigator of more than 20 international clinical trials testing new drugs for cancer and have pioneered the establishment of the Brain and Spine Tumor Center and the Philippine Alliance for Brain and Spine Tumors under the leadership of and guidance of giants such as Dr. Valerie Fulonchan and the late Dr. Eduardo Mercado. But more than the titles attached to my name, it is my utmost joy and pride to have personally walked with my patients in their cancer journey, rejoicing in their triumphs, crying with them when their cancer progressed, praying with them in every critical step of their treatment, and simply celebrating life with them because each day is indeed a blessing. The Cardinal Santos Cancer Center prides itself as being the first one-stop shop cancer center in the country, housing the different cancer care services in one complex. Our chemotherapy adult unit is a 15-bed capacity outpatient facility with a dedicated oncology pharmacy, where we give intravenous chemotherapy for both adults and children, intrathecal chemotherapy or chemotherapy administered through the cerebrospinal fluid, blood transfusions, bone marrow aspiration and biopsy, and central line or portacatheter care. There's probably nothing more heartbreaking than having your own child diagnosed with cancer. So in our pediatric unit, we try our best to ease the pain of both parents and child by providing them adequate psychosocial support through our dedicated child life specialist who counsels our sick children and their parents and help them cope better with this devastating disease. At the Cardinal Santos Cancer Center, we celebrate our patients' big and small victories, encouraging them to count each day as another opportunity to bless and be blessed. We also have the state-of-the-art radiation facility capable of delivering conventional, 3D conformal, and intensity modulated radiotherapy, as well as high-dose brachytherapy Mondays through Fridays, and even during weekends and holidays for patients who need emergent treatment. We recently inaugurated our Vital Beam LINAC machine and will soon be offering image-guided and stereotactic body radiotherapy to treat more complex cases. We take pride in having the best cancer specialists in the country whose passion and compassion for their patients go beyond their call of duty. This team of experts are of one mind in promoting the multidisciplinary treatment approach to cancer management as the only way to deliver the most comprehensive, evidence-based, yet individualized management plan for our patients. The team meets once a week to discuss challenging cases, allowing for an in-depth discussion of the patient's medical condition as well as his psychosocial context, thereby facilitating the creation of a comprehensive management plan that incorporates all aspects of the patient's care and circumstances. This team includes, but is not limited to, as mentioned earlier by Dr. Cauton, medical, surgical, radiation, gynecologic, and pediatric oncologists, as well as medical nutritionists, pain and palliative care doctors, oncology nurses and pharmacists, and pastoral lay workers. We work together for a common goal, to give the best care possible to the cancer patient. We are also cognizant of the potential side effects of our treatment, and we provide ways for our patients to cope with them. For example, a common, sometimes unavoidable consequence of curative breast surgery is lymphedema, or swelling of the arm that was affected by removal of the axillary lymph nodes on the same side of the deceased breast. We have a lymphedema clinic with a dedicated team of vascular cardiologists and lymphedema therapists trained in addressing this problem, a service not available in big centers across the metro. And true to its commitment to provide a one-stop shop for cancer patients, our center also houses the Confianza Boutique for all your cancer treatment-related paraphernalia, from wigs to scarves, mastectomy bras, and lymphedema stockings. Confianza helps our patients live and look their best while they undergo cancer treatment. In Mark 8:36, Jesus said, "And what does it profit a man if he gains the whole world and forfeits his soul?" To paraphrase it in the context of our cancer patients' journey, what benefit would they gain if we extend their lives without saving their spirits? At the Cardinal Santos Cancer Center, we ensure the totality of patient care by providing opportunities for counseling, prayer, and reflection. And if you cannot come to us, we will go to you. Cardinal on Wheels provides services that may be safely done at home, such as blood extraction, growth factor or booster injections, portacath flushing, pain management, colostomy and wound care, among others. The future of cancer treatment, as we have emphasized earlier, lies in drug development. Our cancer center is involved in several phase 2 to 3 clinical trials, testing new drugs for cancer and allowing the Filipino patients to gain access to state-of-the-art treatment, which has not yet been made commercially available. We have participated and are participating in more than 20 international clinical trials and continue to be sought after by clinical research organizations and pharmaceutical companies to be a clinical trial site for their upcoming studies. Finally, we are home to Hope Unlimited, our very own cancer support group, a very dynamic organization of cancer patients and their families that aims to provide a safe environment where patients help each other cope with the diagnosis and management of their disease, including the side effects of treatment. Hope Unlimited conducts activities such as poetry writing, painting, cooking, and Zumba classes for the members and their carers, all aimed at making our patients embrace the truth that there is life beyond cancer. So that, in a nutshell, are the services that we offer at the Cardinal Santos Cancer Center. And this is our Cancer Center team, a group of caring, competent, and compassionate individuals committed to alleviate the plight of each cancer patient entrusted to our care. We invite you to partner with us, and together we will win the battle against the big C. Thank you very much.
Thank you so much, Dr. Malu, for that very for enlightening us about the current and the future trends in cancer care management, most especially during this time of the pandemic. So you see, all the services are already available in our center. Next, we have invited our fighter, one of our very own breast cancer patients. This afternoon, she will take us on her own personal journey in fighting the big C. So please all welcome. Let us welcome Ms. Greta Chua.
In the year 2007, I noticed that there was a lump on the left side of my breast. I had fear and thought that it may be cancer since it's worsening, and cancer is in our genes. But I was still in denial during that time. Not until 2 months later, I decided to face it head on and get it checked. It's a decision I had to make for my family, especially for my daughter, who was only 13 years old at that time. When I found out that I had stage 3 breast cancer, I was not really scared for myself, but I was worried that I couldn't see my daughter grow up. But thankfully, my sister-in-law introduced me to Dr. Valerie Chan of Cardinal Santos Medical Center. And Dr. Chan referred me to Dr. Marina Chuatan, who was at that time was in charge of ALTO study for HER2 positive patients. Luckily, I got into her study, and the first 2 months of my medication was horrible. I was always on the bed, had no appetite, experienced vomiting and dizziness. And the worst part was losing my hair. I felt so weak and helpless that I almost wanted to give up. All I can do is pray. Through prayer and with the help of my family, it made me realize that to live is still the best choice, that not being with them. I came to a decision to accept it and fight the big C. So I continued to undergo various treatments like IV chemotherapy, oral chemotherapy, radiations, and trastuzumab for almost a year. Later on, I was medication-free for almost 2 years, and my hair grew back. But due to the progressive cancer cell in my body, I was re-diagnosed with stage 4 breast cancer in the year 2011. So I consulted my doctor, Dr. Marina Tan, and she then referred me to Dr. Maria Luisa Abesamis-Tiambeng, who is in charge of Marian study for the recurrence of HER2 positive. I was given docetaxel for a year and Herceptin up to the present, which is administered to me via infusion every 21 days in Cardinal Santos Medical Center as a maintenance treatment. So from 47 years old till now that I'm 61, I may say that battling cancer for 14 years wasn't easy. But I'm thankful to all my past doctors and current doctor, Dr. Tiambeng, for being great oncologists. They provided effective and appropriate treatments and ensure that I am well taken care of. As a patient, convenience and quality health care are very important. In Cardinal Santos Medical Center, I don't have to worry about the facilities, as they are always kept safe, clean, and cold. Staff and nurses are all very friendly and accommodating and show concern talaga to all patients. I also enjoy meeting and making friends with other patients who are also in the same situation as mine. There are times I even forget I'm going to Cardinal Santos for treatment because each chemo sessions feels like getting together with friends where we catch up with each other and call each other classmates. I'm really thankful that I was given the opportunity to be treated in the world-class hospital with excellent doctors and nurses. Because of them, I get to embrace the value of life and see my complete family, my husband, my 3 children, 3 grandchildren, 2 daughters-in-law, and my very supportive sister, who has been there since the beginning. I must say trials are an inevitable part of life, but our faith must remain strong. If somebody will ask me, what kept me going in my battle against the big C? I have 3 strong weapons with me. First, prayer. Once we truly submit ourselves to the Lord, we'll start to feel much better and secure. Second, acceptance. This makes us positive and lean towards solutions rather than denial. And gratitude. This helps us appreciate life more. Thank you and stay safe, everyone. I hope that through my sharing, I get to inspire you to be part of this one big fight.
Thank you, Miss Greta, for that wonderful sharing. Thank you for sharing your journey with us. We hope that you will continue to inspire many individuals and families with your courage and spirit. You can be assured that your caring Cardinal family is with you, beside you, and behind you in this fight of yours. All right, so with the roster of our speakers and the wealth of insights and learnings shared now that they have shared to us, we will now open the floor for your questions. Okay, so we have already one question here. This question, maybe Dr. Tiambeng can answer this one. Cancer is often seen as a disease that mostly affects the elderly, but there are definitely cases of cancer detected in younger people. How can we encourage younger individuals to have themselves screened for the disease?
Maybe to answer that question, we have to go back to our Philippine Cancer Facts and Figures. No? Ano ba yung census ng cancer natin? According to the latest census in 2010, around 36,000 new cases of cancer are reported yearly in patients less than 55 years old. And the Philippines actually has one of the highest incidence of breast cancer in Asia, the median age being 47. And our cancer cases for breast cancer actually starts to rise steeply as early as age 30. So these figures tell us that young age does not exempt one from developing cancer. And therefore, because screening is still the key to early diagnosis, particularly for breast, cervical, and colon cancer, then it will definitely benefit our young ones to undergo screening if it's already time for them.
Okay, thank you very much, Dr. Malu. And just a follow-up question to that breast cancer screening. What age do you with family history of cancer, breast cancer?
We usually start screening at age 40, except for patients who probably who carry the breast cancer mutation. We start them earlier using more sophisticated techniques such as breast MRI. No? So if we feel that their family history is very strong, then we subject them to earlier screening and including genetic testing.
Thank you very much, Dr. Okay, we have another question. Maybe we could ask Dr. Kitchie. A popular hack is circulating on social media about men using pregnancy tests as a possible detector for prostate cancer. How true is this? And are there any programs for male-specific cancer?
Actually, there's no truth about that. As what I've discussed earlier, the test for prostate cancer screening is PSA, or the prostate specific antigen test. And this starts at the age of 50, but you can start earlier if you are an African American, or with a first degree relative of prostate cancer. You can start at the age 40 to 45 years old. And of course, the best thing is, of course, to consult your oncologist regarding the right timing and the right tests for a screening cancer for any solid tumor.
All right, we have another question here. I think Doc Pauline can answer the question. For women, cancers such as breast cancer are well known, and there are treatments and programs put into place to detect and avoid the breast cancer.
Sorry,
What?
ma'am. Sorry, can you repeat? Nawala yung aking sound for a sec.
Sige, Dr. For Dr. Pauline, the question is, for women, cancers such as breast cancer are well known and there are treatments and programs put into place to detect and avoid. But men do not have as many resources as women for cancers that affect their population, only such as prostate cancer. So how do we encourage men to have themselves screened to this? There is also a popular life hack on the internet about men using pregnancy tests as a possible detector for prostate cancer. How true is this?
I think the second half was addressed by Dr. Kitchie. Yeah. And I have to say that question has flavors of gender equality. Bakit yung mga women lang may program for screening, yung mga lalaki? No? I think screening in general, we have to understand that there are guidelines which get updated regularly. And the guidelines are based on how helpful or how does it affect, no? If screening at an earlier age affects the outcome, meaning is there a reduction in death? Is there a reduction in, basically yun is there a reduction in death of this type of cancer, right? So hindi automatic na if there's a test, there should be a program for its screening. No? If they find that it doesn't affect the mortality in the end, then it might not be a screening method worth funding. No? So you have to think of it in that sense. Again, also, si Dr. Tiambeng mentioned the statistics, right? So while men might feel, bakit walang program, funding, or whatever to address male cancers, we have to think also of what are the most common, right? Breast is there, definitely in the top 3, but the others are cancers that affect both men and women. No, there is lung cancer, there is colon cancer, and there are screening programs dapat and recommendations in place for that. No? So I guess I'm mentioning that because in our search for having something for the men, we should not forget the cancers that affect both genders, right? And in encouraging anyone for screening, no, whether it's prostate or otherwise, or even for women, no, for breast, I think we need to zero in on the fact that how does screening save lives anyway? No? We really treat cancer better when we catch it early. And a lot of times, when you start feeling something, no, and or when you go to the doctor because you're already symptomatic of the cancer, it's usually a picture of a more advanced type of cancer already. So how do we convince people to go for screening? Say that the earlier we catch it, the earlier we can treat it, and then the better chances we have of beating it.
Thank you very much, Dr. We have a question here. I think this is for Ms. Greta. Hi, Ms. Greta. If you could go back in time, what would have done differently? What you have done differently as a cancer survivor? Ms. Greta,
Sorry, come again.
The question is, if you could go back in time, what would you have done differently as a cancer survivor?
Just the same. Ganun pa rin ang gagawin ko. Magpapagamot pa din ako. I will undergo chemotherapy. Kung anong advice sa akin ng doctor, yan ang gagawin ko. Because syempre, gusto kong mabuhay.
Yes.
Yun, di ba? As I've said na, it's better to live than hindi ko makasama yung family ko.
Okay.
That's all.
Thank you, Ms. Greta. So we have another question. Okay, can cancer, I think this is for any of our doctors, no? Can cancer patients and or cancer survivors undergo COVID vaccination? Can they receive vaccine?
I can answer that, Ma'am Eddie. Yes, they can
sure.
undergo COVID-19. Is it the COVID-19 vaccination? Are they talking about the COVID-19 vaccination? If it's the COVID-19 vaccination, they can. And actually, we advise them, we encourage them to do vaccination. You just have to talk with your oncologist, your medical oncologist, with regards to the timing of the vaccination. It can be done 7 days or 1 week prior to the chemotherapy and 2 weeks after the said chemotherapy, or after the session or the cycle of the chemotherapy. As long as the schedule is being discussed with the medical oncologist, you can do the COVID-19 vaccination.
Yes, definitely, because they are compromised. They're immunocompromised, so definitely they are priority. All right, thank you very much, Doctora. And we have another question here. I think this is also for any of the doctors. What have you observed as to how patients have adjusted to the pandemic in terms of getting their treatments this year compared to last year? So siguro baka gusto nilang sabihin kung are they more compliant now, or are they defer their treatment? So I think any of you, Doctora, can answer the question.
Yeah, maybe I'll answer that. Patients generally have adjusted quite well compared to the early onset of the pandemic in 2020. Our cancer center is busier now, as you may have observed. The patients are no longer as afraid to undergo treatment or even diagnostics to address their cancer. Knowing that the center is equipped and with ways and means to protect them from infection, we have instituted ways and means to make it safe for them. So kahit papano mas konti na yung nagde-defer ng treatment because of the fear of contracting COVID-19 in the hospital.
Yeah, yes, Doctora, I agree, because last year and this year almost the same. Patients medyo dumami pa nga because of our new LINAC machine. So I think, and they feel more safe or safer now, especially that we require the RT-PCR. So I heard feedback from our patients and the relatives na hindi na sila natatakot because they know that everybody is, alam nilang negative. They think positive but negative ang result.
Yeah.
So another question. So I think this is for Dr. Pauline. I'm 52 years old breast cancer patient and done with the adjuvant chemotherapy and radiation therapy. I think she's asking what's next after that, the chemo and radiation therapy.
Okay, so what's next would be an important conversation with her oncologist because your oncologist needs to be in charge and on top of the course of treatment, right? So there would be, kumbaga, the next step would really depend on a lot of different factors of your tumor, no? Whether you are hormone positive or negative, or even HER2, etc. So the best person to be able to answer that would be your medical oncologist, Bob. Yes. So plan out the next couple of years of what's going to happen. Yeah.
Thank you, Doctora. So here's another question to our doctors. When the pandemic started, how were your patients received the news and were they scared when it was starting? And how were you able to convince your patients to get vaccines for COVID-19? Dr. Kitchie? Or
Yes, actually, there are strict protocols before we undergo treatment with our cancer patients. And we always tell them that ang cancer hindi natutulog. So pag walang treatment, pwede itong maging, it will become worse, or even it will become in a metastatic form or stage, which is a worse form of stage of cancer. So we always tell them that the treatment for their cancer is always the essential, or it is always the best treatment is to go to their medical oncologist and have their treatment ASAP. And actually, most of our patients during the pandemic, especially last year, those who are scared of having face-to-face consult, we do e-consult, we do online consult. And then for those patients who really need treatment, we advise them and encourage them to undergo treatment ASAP with strict protocol. And of course, we also do swabbing or COVID swab RT-PCR test prior to the chemotherapy to ensure that everyone in the chemo unit is non-infectious. So we reassure them also.
thank you, Dr. I think this question is for Dr. Tiambeng. Most of the people who are diagnosed with cancer do not proceed with treatment due to lack of financial support. That is why they decide to wait for their time of death instead of finding ways to have the money for the process and treatments. Is there open help for them other than the government programs, since hospitalization itself will cost them I think it will cost them much money. Thank you.
All right. That, when it comes to finances, it's always a very tricky and difficult question to answer. But what I can tell you is that help is always available. Okay. So do not give up just because you think you have no money to support your treatment. We have seen many patients who are not well off complete their treatment, just exhausting every possible avenue available. So we are also affiliated with government hospitals, DOH hospitals, for example, that sponsor chemotherapy drugs, for free for breast cancer patients, even lymphoma and colon cancer patients. Then at the Cardinal Santos Medical Center, for brain and spine tumor patients, for example, we have the foundation, the Philippine Alliance for Brain and Spine Tumor Patients, that assists brain and spine tumor patients with their chemotherapy, radiation, and even surgery, and even diagnostic tests such as MRI. And Cardinal itself also has a foundation, the Cardinal Charities Foundation, that is always ready to help patients, especially those undergoing procedures in the center. They are given assistance through the foundation. And we have aligned ourselves, affiliated also with the San Juan City government, for example, and through their Malasakit Center, San Juan residents are able to get their treatment in Cardinal Santos, assisted by the San Juan City government. So wherever you are, wherever you're coming from, the most important thing is to take the first step. Consult first. Consult your doctor, your oncologist, and then be very frank and be very honest with whatever hindrances you may have in going through your treatment, and we will be ready to help and find ways for you to receive your treatment.
Yes, thank you very much, Dr. Tiambeng. I think communication with your consultant is very important because there are a lot of assistance in our hospital and even with the government institution.
Yeah,
So,
and if I may add, I forgot, Eddie, if I may add, we also have clinical trials, and our clinical trials have helped our patients get the state-of-the-art treatment and even diagnostic tests for free if they are deemed eligible, if they are if they meet the criteria of the clinical trial. So that's another avenue by which we can help our patients financially.
Yes, Dr. Thank you. And there's also the program for the pharmaceutical, like the RAP, the Roche,
Yeah.
and so on. So they can always talk to their attending medical doctor. So we can entertain at least 2 or 3 questions. This one, I think this is for Dr. Kitchie. Does sugar or meat multiply cancer cells or increase chances for cancer to recur?
It's a misconception or a myth. I think I've answered that in my discussion earlier. It has no clinical research or evidence to support that data. But of course, if you eat a lot of sugar or foods rich in sugar or meat, of course, this will lead to obesity or overweight, and obesity or overweight leads to, or one of the causes of cancer, and not only cancer, but also other diseases like heart diseases. So we always say to our patients that they have to eat in moderation. That's the key.
Yes, thank you, Doctora. So there's another question. I think this is for Dr. Pauline. What are your thoughts about cryoablation? Will CSMC offer cryotherapy in the future? Dr. Pauline and Dr. Malu, I think.
Cryoablation for, I think, depende po, no, what kind of cancer we're talking about. Because I think the topic of cryoablation can be applied for some lesions like in the liver or in the cervix area. I don't know about the status of Cardinal employing cryoablation. I'll need to have to ask, phone a friend for that.
Maybe I'll answer that question. Cryotherapy has been around for many years. No, in fact, a center in China has been recruiting patients in the Philippines for cryotherapy. Unfortunately, they have overextended the indication for cryotherapy. There is a role for cryotherapy, particularly for very small tumors that have not spread in other parts of the body, like prostate, for example. No, there was a role. It was popular before, but because there are already other treatments that are effective for prostate cancer, it has also somehow lost favor amongst our urologists. Cardinal Santos does not offer cryoablation. We just feel that it is not one of our strengths, perhaps, and also it does not have a lot of indications at this time with the advent of the newer radiation techniques and even other forms of local treatment such as microwave ablation, radiofrequency ablation for liver tumors, for example. We have put our investments more in more of these latest technologies rather than cryotherapy or cryoablation.
Thank you very much, Doctora. So this is our last question. We will be entertaining our last question. Any of you, I think you can answer. This is from Lucky Magni. Tumaas po ba ang number ng cancer patients during the pandemic? What are the challenges that your hospital encountered this pandemic? Like hindrances in screening, check-up, treatment, and paano po nasusolusyonan ninyo ito?
Yeah, maybe I'll answer that. No? Tumaas ba ang census during the pandemic? Well, at the start of the pandemic, bumaba po yung census. That's the truth. Because patients were really afraid to go, especially March, April, May 2020. Patients were not coming in even for biopsy, no? And most centers also closed their outpatient clinics. Their surgery was only for emergent or urgent cases, etc. But as we got used to it, and we realized we cannot stop treating our other patients, no? And open up our services again, the patients started coming back. And our census now in 2021 is at pre-pandemic levels already, if not higher. No, if Eddie would support me on that. So how did we encourage our patients to come for treatment or even for diagnosis? We just told them that number one, cancer, as mentioned by Dr. Kitchie and Dr. Pauline, it does not sleep. It does not wait. It will not wait for COVID to go away. And it is actually more deadly than COVID. So you have to be treated for your cancer. Number two, yun na nga, we have really made our center safe and secure for our patients, so that when you come, there is a strict triaging of patients, screening of symptoms, so that, and then recently we have made RT-PCR a requirement, just so everyone feels secure that you will not contract COVID while receiving treatment at our center. And through education and word of mouth, as well as we educate more patients who educate also their relatives and friends, we're able to encourage patients to come for diagnosis and treatment.
Okay, thank you very much, Dr. Tiambeng. I agree with Dr. that cancer is already there. We are not going to wait for the COVID to stop and to disappear before we treat, because cancer is just like hemodialysis. They're there, right? So we really need to treat our patients with or without COVID. Thank you very much. So with that, we would like to, and as much as we would like to accommodate all your questions, but in the interest of time, we will just forward your questions to our speakers. Thank you. And with that, we formally conclude this afternoon's Webicon. This would not have been possible without the collaboration of different departments in our hospital, our media partners, and most of all, our valued patients, partners, and guests. Thank you so much, everyone, for making our Webicon a success. To our speakers, Dr. Kitchie, Dr. Pauline, Dr. Malu, and Ms. Greta, thank you so much for spending your time with us. We hope that we were able to enlighten and motivate everyone to never forgo medical treatment, as we ensure everyone's safety in providing world-class medical care. At Cardinal Santos Medical Center, we are here for you in your journey for that one big fight. So once again, let us know your Webicon experience by logging on www.menti.com, inputting the code 7715001011 to evaluate this session and let us know your suggestions and recommendations. You may also access the evaluation, which will be emailed to you shortly. Thank you very much. And before we finally end this session, we will be promoting everyone to be panelists. So please, you may open your videos and turn on your cameras for our photo ops.
Oh.
Please open your cameras. Show us your beautiful faces. All right. Are we ready? Okay. All right. So smile, everyone. Smile.
Okay.